Nursing homes are just one option. A recent study by the American organization AARP found more than 40 million Americans are caring for an elderly or disabled loved one at home. So for the caregivers, the question is how best to manage the needs of your loved one with your own. It's an issue I discussed with Lynda Shrager. She's an occupational therapist and caregiving expert, and also a featured blogger on everydayhealth.com.
Well, there's a lot of challenges that caregivers face every single day. You've heard of the term the sandwich generation. Back in the day, that used to mean usually women in their 40s or so caring for their children and their elderly parent. What's happened, though, is that people are living longer. So instead of just having to care for your parent, often the person is caring for their parent and their grandparent, along with their children and their grandchildren. So the question is, how do we find time for ourselves? Do you go to your daughter's dance recital, or do you go to your mom's doctor's appointment? Do you run out of a mandatory office work meeting because your dad just got rushed to the hospital? This is a very big problem that caregivers face today.
Lynda, the AARP study I referenced just a few minutes ago estimated that the value of the work done by caregivers just in the United States alone is about $450 billion each year. But of course, family caregivers aren't usually paid, and you were talking about this do I get to the dance recital? Do I take care of dad? You talk about all of that, but the simple question is, for these caregivers, and many of them don't know the answer, how can they get a break?
Well, Mike, you're right. How can they get a break? And that is such a hard question to answer. I tell people one of the best ways is to seek out support. A support group is very, very good because there is nothing better than someone sitting right next to you or in a chat room, if we're online, telling you how to do this because they've been there and they've done that. The caregiverspace.org is a really great website. They are designed just for caregivers who are very isolated and dealing with these problems on a day-to-day basis. It's very important to ask for assistance, and often caregivers do not do that. They think it's their mom, their dad, their child. They can do it on their own, but I'll tell you, that's a mistake. My suggestion is to make a list of everything that you as the caregiver do each day for the person you're caregiving for. If you have those in a list, then when somebody asks you, what can I do? You actually have it written down. There are specific tasks that people can help you with. Consider hiring a home health aide. Home Instead Senior Care is an example of an international home health agency. As a matter of fact, they're opening in China this year, and they are found throughout the world. They've already vetted their caregivers, and they are there to help you to know what you need and to place the proper person in the home. Often I'll tell people that having a caregiver, a home health aide in the home, can be the difference between mom or dad going to a nursing home or staying home.
Lynda, we don't have much time. We have about a minute, but I want to kind of touch on your personal story. About 2 decades ago, you and your daughter were both diagnosed with potentially life-threatening medical conditions on the exact same day. Now, sometime later, your mother was diagnosed with an aggressive form of cancer, and along the way, you developed some really important skills and tips for caregivers. What are the top 3 things you'd advise people to keep in mind if they find themselves in the caregiver role?
Okay, well, the top 3 tips I have are, first of all, have a plan in effect before a crisis occurs. Don't let that crisis happen without knowing what you're going to do in case it does. My second tip, educate yourself about your loved one's medical condition and their diagnosis. Knowledge is power, and the more knowledge you have, the more you will be able to deal with the situation. And the third and most important is to get organized. If you're organized, it will help you to get through the medical maze and negotiate the healthcare system much easier. So, for example, create a healthcare notebook, just a binder, and in it, keep all the information that you need on the person you're caring for.
Lynda Shrager, thank you for that valuable advice.
Thank you, Mike.